Okay, welcome everybody who's tuning in today to the Ask the Doctor session, which is our very last session for this year for making the healthcare system work better for you. Thank you all for taking time out of your schedule today to participate in the conversation. So I hope that you all have come with questions to ask Dr. Melissa Clarke, since this is Ask the Doctor. So if you've participated in one of our Making the Healthcare System sessions, Making the Healthcare System Work Better for You sessions, either last year or this year, it's your opportunity to bring your questions to the doctor and get your questions answered. And so this is really a free-flowing session today for us to have a conversation about maybe some burning questions that you've had that you didn't have an opportunity to either ask or get answered if you participated in one of our previous sessions. So if you have participated this year, Dr. Melissa Clarke has been our subject matter expert. She is an author, TEDx keynote speaker, health show host, thought leader, physician, and educator, as well as a population health expert. She's a Harvard-educated emergency medicine physician with over 30 years of healthcare experience, and she has been on the front lines of addressing health disparities, health literacy, and improving the way doctors and patients work together. So a lot of what we've been talking about this year in the five-part series has been really based on Dr. Clarke's book, Doctor, I've Got What, which is a roadmap for how to be a smart healthcare consumer and understanding why now taking control of your health and healthcare is more important than ever before. And so I will invite Dr. Clarke to join us in the conversation for today. So this is really going to be a Q&A. So hopefully you have questions. And if you do have questions, please put them in the Q&A box. And we can go ahead and get started. I am going to stop sharing my screen. And Dr. Clarke, how are you doing today?
I am doing great, really excited to participate in this session with everyone.
Yeah.
Your so far the questions that I've gotten as we've gone along have been great. So I'm looking forward to answering even more today. And I think now more than ever, it's important to be an empowered healthcare consumer. We have so many changes happening around us that rather than seeking to expand access to care, policies are being put into place that are going to decrease people's access to care. So now it's more important than ever to really understand how to interact with the healthcare system effectively to get the best quality care that you can, um, uh, given your insurance coverage or financial situation, your overall health in general.
Yeah, I totally agree with that. And I think that, when we talk about health empowerment, yeah, definitely that is going to be more critically important now than ever before. And who knew we would end up in this place, right? And I think it's a perfect example of the connection between your health and your vote, right? And I think a lot of people don't necessarily see the correlation or the connection there, but I think hopefully over the last 6 to 8 months that people have become more aware of that and the connection with that.
Yeah.
So as we move forward and think about the opportunity to maybe change or have an impact on our health and what we have access to, not to be too political, but it is important to exercise your right to vote.
Yeah,
And make
I
sure
think
that,
that's said in a very neutral way.
yes, yeah, and
There's
make
a
sure,
direct line between the policies that the people that you vote for and then the policies that get enacted and then how that shows up in your everyday life in terms of your health.
right, and making sure we choose the right people to represent our best interests. And I always say, don't go by what people say, go by what people do. So, when people are campaigning for office, they will say a lot of things to try to get elected, right? But, we as citizens and constituents can go and see what their voting record has been and what direction they lean towards and how they have supported or voted on things that either are in our best interest or their self-interest. So strongly encourage people to make sure you do your due diligence and do your homework and make sure that you're making a well-informed decision, no matter what decision you make. So we're here today to talk about healthcare, and don't know. We did have one question in the chat, but it was about a gift card. No, we're not giving away a gift card today. We had a contest for all the previous 5 sessions, but not for the session today. So we hope that people are here because they really want to understand more, and especially how they can navigate through this ever-changing complex healthcare system, really create the right healthcare team, how to be a more empowered and well-informed healthcare consumer, and how we can hopefully move forward and navigate through the next few months to a year with all these changes that are happening. So I see are there any questions in the chat? There's no questions in the QR box, but any questions in the chat?
Not yet.
Not yet. Okay, great. So we'll just, what we'll do, Dr. Clarke, is just, talk about some things or answer some questions that have been asked before in previous sessions or that were in our survey feedback that people didn't necessarily get to ask or get answered during the session. So we'll just go in sequential order. We'll start with taking ownership of your health. So I think when you mentioned in that particular session that we are the coach of our healthcare team, or the quarterback, or however you want to phrase it. And so can you talk a bit about what taking ownership of our health looks like in everyday life, and especially now for people who may feel a little bit overwhelmed or not certain about what to do, as we navigate through HR1, or how that's going to impact their access to healthcare?
Yeah, sure. So that's a really broad question, and I guess I'll have to put it into 2 parts. Our first, what we covered in our first module, our first session, was taking ownership of your health from a self-care perspective. And I talked about the 5 self-health actions that really maximize your health no matter what state of health you're in. If you're well, they help you stay well. If you have a chronic condition, it helps you operate at the top of your game with your chronic condition. And so those include nutrition, basically what you put in your body and what you expose your body to. So that includes proper hydration, avoiding processed foods. It also includes focusing on a plant-based diet, so not eliminating meat, but thinking about lean, healthy cuts of meat and really making plants and fruits and vegetables the focus of your diet. And then it also includes movement, right? So getting in enough movement every day, at least 150 minutes a week of movement. And then sleep. We really want to try to allow our bodies to rest. That's when our bodies recuperate and do a lot of the self-repair that's necessary to stay healthy. And that optimally is 7 to 8 hours. And for children, it depends on the age. It could be up to 9 to 12 hours, depending on the age group. And then finally, what I say is the most important of the 5 is managing the stressors that we all encounter. And so there are research proven ways to do that, to decrease your stress levels, because when you're under stress, your cortisol levels shoot up. That causes a whole bunch of cascading events to happen in your body that are detrimental to your health. And so meditation, prayer, hobbies, social interactions, all these things help to decrease our stress levels, our cortisol, and help our bodies be able to optimally repair. But then when you have to interact with the healthcare system, there are a whole sort of suite of ways that we've gone through as we've talked through these several modules. One is access to health insurance and what to do if you don't have access to health insurance. For those people that don't have access to health insurance, we talked about going to community health clinics to make sure that you maintain relationships with a primary care physician who can help you be the coach. You're the quarterback, they're the coach for your health care. Um, and help to make sure that you continue to get all the preventive screenings, vaccinations, etc., that are needed to optimize your health. We talked about advocating for yourself and being prepared for visits. That also is a key way to make sure that you're getting the highest quality health care. I think I won't go into all those details because I'm sure you'll have some follow-up questions around that. But I think especially as we're going into this time, as I mentioned before, where there's going to be a limitation, a tightening of access to healthcare, knowing that you can access community health centers, um, knowing that with Medicaid, there are going to be work requirements. Those work requirements, for example, aren't necessarily that you have to get a job. It could be being in school. It could be volunteering. And it could be a part-time job. It's 80 hours a month. So knowing the specifics around making sure that you have coverage access is going to be really important.
Well, thank you for simplifying that a bit, especially with the work requirements for Medicaid. But I do want to go back to a couple of things that you said. So what I heard you say is like it's important for us to stay away from processed foods, try not to eat anything in a bag, box, jar, or can if we can manage. And that's important to know how to shop in the grocery store, right? If you notice when you go in the grocery store, most of the fresh produce or the non-packaged or non-processed food is on the perimeter of the aisles. So best to shop the perimeters. And if you can't do fresh, best to do frozen as a second choice.
Yep.
And then you talked about sleep and stress, and I would imagine there are probably quite a few people that are a bit more stressed now than usual, present company included, for various reasons. But a lot of us may not know what cortisol level means or how that really impacts our health and well-being, our immune system, and all of that. So can you dig a little bit deeper and explain why that's so important?
Sure, I'd be happy to. And before I go there, I just want to pick up on the thread that you left around shopping the perimeter of the grocery store and the role of processed foods, which means, as you mentioned, anything in a jar or a package, anything that has been added to after it came out of the ground or in its original state. And there is a study just that came out last week that's showing that we're getting colon cancer rates at earlier ages. Think of course, uh, Chadwick Boseman, uh, you know, and the fact that he was younger. What we're seeing, what this study showed, is the increase in consumption of processed foods and how many servings of processed foods a day seems to be linked to our rates of colon cancer and the fact that they're happening at younger and younger ages. People who are older, um, we're exposed to less, right? Processed foods. And now we're seeing it basically, you could go all day and just eat processed foods because they're sort of everywhere. So just a piece to add on to that. And then when it comes to cortisol levels, cortisol is what is called a stress hormone. When we feel, the definition of stress is when you feel that the resources available to you don't match the demands of the situation you're in. And when you feel that way and you internalize that, chemicals get released in your body, one of which is cortisol or adrenaline. And what this causes to happen in your body is all your energy goes into being ready to run or to fight, right? Defend yourself. This is good if you're actually in a situation that is physically could be physically damaging to you. Think, being in the jungle and being, trying to outrun a lion, right? Which is what it was originally used for. That's really important. But if you're constantly under stress and these hormones are really at their highest levels, what's happening is it's robbing your body of the energy that it needs to repair itself and create new healthy cells, right? Because all the energy is going into thinking about defending yourself and running away. And so, unless you do something actively every day to remind yourself that you are enough, that you have enough, um, then you're going to be overwhelmed by stress and have this cascade of your body being depleted and not being able to repair itself and create healthy new cells.
Great, thank you for that explanation. Um, and so you kind of talked a little bit about practical steps that people can take to feel more grounded or prepared, or like what to do with your healthcare team. But we also talked about like, you know, starting from the very beginning and choosing the right healthcare provider for you. So can you talk a little bit more about practical steps that people can take to choose the right PCP or primary care doctor and then create the rest of the team?
Absolutely. So, I say there are several resources available to help you choose um, the right doctor for you. One is you can actually, if you have health insurance, they often have directories that include the characteristics of the doctor that you'd be going to see. In addition, there's word of mouth. I think that's wonderful. If you move to a new city and you're talking to friends or individuals you meet who live there, ask them, are you satisfied with your doctor? I'm looking for a new doctor. Um, and then when you get to that individual, it's just like you're dating, right? For the first time, you're going to have some questions to understand, hey, is this person compatible with my values and what I'm looking for in a doctor-patient relationship? So there are a whole set of questions that include assessing their listening skills. Are they hearing you out? What is their attention span? Do they seem to cut you off? Um, what is their capacity for compassion? When you tell them something, do they seem to empathize with you or at least give you the space to do that? What is their openness to other healing modalities? Perhaps, Reiki or chiropractic or acupuncture is important to you. This person is your coach, your health coach, and so they have to know all the things that impact your health, including you're going to alternative practitioners. Um, are they clear in their explanations? Do they use simple language? Do they promote what I call or what is called shared decision making? So there's always multiple options with any problem. Doing nothing is an option. All these options have consequences. So are the options explained to you so that you are a participant in making the decision that works best for you, regardless of what those consequences are? And then do they also, lastly, seem to know their limitations? If you ask them the question and they don't know, do they honestly say, look, I don't know, but I can get back to you on that? So those are sort of the list of questions that I say interview your doctor. And if you're not satisfied with the answer, move on. If you feel mistreated, move on. There's no reason to stay in a relationship that's not serving you. Seek other doctors and continue to go to sources that will help point you in the right direction.
Yeah, and one thing I want to mention to your point about if you aren't treated respectfully by your doctor, there is a way to file a complaint, right, against your physician. And there's a formal process to do that, and also with your healthcare plan. If your healthcare plan does not deliver on the promise it made in exchange for the premiums that you pay every month, there's a way, at least here in California. I'm not sure how it works in other states, but here in California, you can call the Department of Managed Healthcare Services to actually file a complaint. If it's against your physician, for your healthcare plan, you have to start there with them, but ultimately you can still file a complaint with the Department of Managed Healthcare Services here in California. But you do have the right to actually file a complaint, should that be the case and you have that type of experience. And while we're talking about patient rights, that was one of the sessions that we talked about last year, but we also talked a bit about this year. So when it comes to patient rights, we know that it's important for people to know what their patient rights are, but what are some of the top three things that you think people really need to know when it comes to their patient rights and exercising their patient rights?
Yeah. Well, I would say, in a multilingual society, such as California, it's important to know that you have the right to a translator. A lot of people don't know that. They, end up maybe using a family member, especially a child, where you might not want to really share with them your health history, but they feel they have no choice. Um, and so knowing that you have the right to a translator is important. Another right is what I just mentioned about shared decision making. You have the right to participate in your healthcare decisions and always ask, if presented with a care plan, what are the alternatives and what are the consequences of choosing, making different choices so that your values and what's important to you can inform, the decision in the course of your care. Um, and then I would say, for the third one is a lot of people don't realize that they have a right to their medical record, not just the summary of it, but the actual medical record. So if any questions come up, there is a law that says you have the right to access your medical records and they should not be kept from you. So, and you can read them over, right? And for example, for a doctor's visit, to make sure that what you said was appropriately represented in the medical record. So I would say those are the top three that maybe people don't know, but should know because it is your right.
Yeah, and so are these results and information that would be different than what you would find in the patient portal if you sign up and set up an account?
It probably depends on the provider. I don't
Mhm.
know that all providers make the entire medical record available in the patient portal. Typically, it's a summary, like a discharge summary or a patient visit summary, and then, the results of your labs. I'm talking about like the actual documentation that the provider makes when
Right.
they are summarizing your visit.
You mean
Um,
like the soap notes? Is that what you're
the
referring
SOAP
to?
notes, exactly. Yes.
Okay, and then for those of people in the audience who might not know what soap notes are, can you explain?
Yeah, sure. So SOAP stands for Subjective, Objective Assessment and Plan. So subjective is when the doctor interviews you and asks you questions. So they document your responses. Objective is when they examine you, right? So that's including your vital signs, your blood pressure, your heart rate, your temperature, how fast you're breathing, and then any physical examination that you do. Assessment means what is their conclusion, right? After gathering this initial information from you, what is the conclusion or the assessment? Um, and it should typically involve at least two options, right? Um, and then, from all the data they've gathered and, trying to understand what's wrong. All right. And then the plan, which is P, is okay, so how am I as the provider, um, what is your care plan? It might involve getting more data, like getting more labs. It might involve referring you to another provider. It might, a specialist. It might involve having you, lose 10 pounds, right? It might involve you being referred to a nutritionist or checking your blood sugar 3 times a day. So all that would be involved in the plan. So what is your care plan going forward? So that's what SOAP stands for. Typically, you get just a summary of the visit, but the actual documentation you also have, a right to.
Yeah, and I think that's often important because, and especially when we're talking about being a patient of color or a patient that may have a different background than the provider that we're seeing, oftentimes there are assumptions made about people. Um, and you and I know that health really happens outside of the four walls of any community center, health center, or any type of healthcare facility, but oftentimes, say if someone shows up and the doctor may ask, have you taken your medication? And the person says no. I don't know how often they ask why, but that goes in the SOAP notes. And sometimes it's classified as the patient's non-compliant, or there's some other assumption made about the patient, when it may be very well that that person either was so busy they didn't get a chance to take their medication, or maybe had to make a trade-off between paying the
Couldn't
light bill
afford
or
it.
getting their prescription.
Yeah.
So in those situations, I think it's important to know what's in your SOAP notes, that a patient isn't miscategorized for something that that's not factual or true.
Right.
So
And just to add that, excellent summary. Thank you, Rhonda. And the other piece I would add on to that is the purpose of the SOAP note. It serves two purposes. One is it reminds the doctor from visit to visit, you know, what they should be following up with you on, right? Where you left off. But it also plays a huge role in communication between doctors. So if that doctor refers you to a specialist and they've put something in the SOAP note that doesn't present you in the best light, for example, the person is quote unquote non-compliant with their medicine, meaning they're not taking their medicine, but they don't really document why, then that person who now sees you next may have a bias in their head in terms of what kind of person you are, right? So that's another reason why if you feel that somebody that you go to or get referred to has some preconceived notions before they're actually sitting down to talk with you, you can ask, well, what did the doctor tell you about me? And that's an opportunity perhaps to correct their perception.
great, great point. So I see I'm excited. There's a question in the, oh, they just said, okay. I guess that was about the gift card. I thought there was actually a question in the Q&A
Okay.
box. But I will ask the next question until somebody lets me know that there's a question from the audience today. And so we also talked a lot about self-advocacy. Um, what does that look like when when there is a situation where doctor may misclassify or categorize someone, or dismiss symptoms, doesn't listen to you, or minimize your concerns? How can someone turn that situation around, advocate for themselves, and be more proactive and make sure that they
Yeah.
get kind of the care they need in that situation?
Absolutely. I think this a similar question came up during one of the conversations in the previous session, and it does depend on whether it's an emergency situation, right? Where you're in a life or death situation, you really kind of don't have a whole lot of options other than just being insistent. Um, the best way, I think, to advocate for yourself is to come prepared, right? With what you want to talk about and what your agenda is, and make that known up front so that there's not a chance for it to fall through the cracks or to be dismissed if you let the provider know at the beginning of the interaction, look, these are my priorities and this is what I need to get addressed during this visit. The second thing is, if you feel even after that, that the doctor or the provider is not giving you the proper attention, not respecting your agenda or you, um, you know, course correct in the process of the discussion, right? Always knowing that you can move on to another provider, right? So if the person responds appropriately after you've course corrected, then give them another chance to do right by you, so to speak. But if after more than one attempt they don't seem to be changing their behavior, it's time to move on because there's a mismatch between how you need to be treated and the treatment that you deserve versus what you're getting, and look for a provider that's more aligned with you and your values.
Great. And we do have the right to get a second opinion as well as fire our provider if they're not serving
Exactly.
us well. Yeah, yeah. And then so we did talk about like having access to your medical records. Um, And so what would you say are the most important documents that one should have access to or know information about their health?
Yeah. So I always say get a written copy of everything. And that's much easier now that we have patient portals. So
Mhm.
that's especially lab tests and, you know, test results, ultrasound results, CAT scans, MRIs, uh, biopsies, etc. So that you have a written copy of it. And typically it'll say on there if there's something that's not normal, right? And so you can always say to your doctor, hey, can you explain this to me? So having access to your test results, that's the first thing. But other documents that are important as you think about your healthcare journey, one is an advanced directive. Let's start there. An advanced directive is something that everyone, even teenagers, should have in place so that if anything happens to you and you can't speak for yourself, and we know that unexpected things happen all the time, that you have your wishes laid out. So if you can't speak for yourself and you're on life support, what do you want to happen? Do you and when you go there's software online that can help you put this together. There are pro bono lawyers that will help put this together, or you could pay a lawyer to help you put it together. But it'll guide you through a series of questions. There's one popular one called Five Wishes. For example, it's free online. And it'll guide you through a series of questions that help document what is important to you. And then once you finalize that, make sure your doctor has a copy of it. And ideally, your local emergency department has a copy of it, that it's in your medical record. The second important document um, is a medical power of attorney. It kind of goes hand in hand with an advanced directive, but it's also a legal document that stipulates who, in the case that you can't make decisions for yourself, you're allowing to make decisions for you. For some people, that might be a spouse. For some people, it might be a best friend. For some people, it might be a child or a parent. But you know who best in your life you who you know could make decisions based upon your priorities and what's important to you, who you know is not going to fall apart in a crisis, right? Um, and it's important too, when you choose that person, to have that conversation with them up front and let them know, look, I'm doing this proactively. I hope we never need it, but I trust you, and these are the things that are important to me. And let them know up front what is important to you. Share your advanced directive with them so that they know and they don't have to worry whether they're making the right decision um, that represents who you are.
Yeah, not always an easy or desirable conversation to have, but important. And then I think the other piece of that is to make sure that in your provider's office or your doctor's office, that there's a person who is listed who can call the doctor's office or ask questions about your health, especially if that person is your advocate or designated in your medical directive. So it's important to also kind of close the loop in that way to make sure that that person has permission to ask questions about your health and even access your healthcare records. So
Yeah.
we actually do have a question in the chat this time, and someone wants to know, how can a patient address the doctor about wanting to record the medical session, like in their appointment when they're having a conversation?
Yeah. Just let them know that this is the way that it's easiest for you to remember the advice that they have to give you, and that you'd like to record the conversation.
Great. And then the person is asking, can you discuss a respectful way to let your doctor know that you want to get a second opinion to avoid feeling uncomfortable?
Yeah, no, that's a great question. And diplomacy goes a long way if you want to retain your relationship with that doctor, because even though it is your right, right? Um, this person feels invested in their opinion sometimes. And so I think it's important to just let them know, look, you know, this is especially you're probably getting a second opinion because it's something that's really important and impactful to you. You know, like if it's something that's a minor issue, you're probably not going to be that motivated to go get a second opinion. So express that to the doctor. Let them know, look, um, you know, I trust you, we have a relationship, but this is a major decision for me, and I'd like other input to help me make this decision. And so that's why I'm getting a second opinion. Um, I think sometimes it's good. You don't necessarily you have no obligation to your doctor to tell them that. Also, you can also just go get a second opinion. So, you know, it just depends on the relationship that you have and um, you know, how you want to proceed going forward.
Great, thank you. Are there any questions in the chat by chance? No, okay. Oh, thank you, Charity. Were you about to tell me no? Thank you. Somebody's making a comment about a second opinion. I don't think it's a question, but thank you. And so when we're thinking about creating our healthcare team, there are a lot of participants who said, excuse me, that this session really helped them understand the roles of doctors, nurses, specialists, and wellness providers. So why is knowing the difference between, I think it's maybe pretty straightforward, but the question is, you know, why is knowing the difference between the different types of providers so important and so important to building your healthcare team?
Yeah, you know, it's just like a football team. Everybody has their position, and you got to be able to lean on the ones that you know are experts in what they do. And so if you have a challenge, a health challenge, it's important to know who to go to for what. And sometimes people don't even know that there is somebody that they can go to for that issue, right? So for example, for individuals who may have had a stroke. They might not realize that there are three different types of therapists that they should be engaging with, right? A physical therapist to help them restore their strength, an occupational therapist who can help them, you know, do functional tasks, and then a speech therapist if they have any memory impairment, swallowing impairment, or actual speech impairment. So knowing that those people are there are important, important part of advocating for yourself. If for some reason you qualify to see one of these people and you're not seeing them for whatever reason. So that to me is the most important. It's a role in being able to advocate for yourself to know what to expect. I had a stroke, I should be seeing these people, right? I got diagnosed with diabetes, I should be seeing these people. I should be seeing a nutritionist. I should be seeing a foot doctor, a podiatrist. Um, I should be seeing a heart doctor periodically because people with diabetes have higher rates of heart problems. So again, knowing uh, what good looks like means that you can then advocate for yourself to make sure
Great.
you're getting it.
Great. And so I think more and more, especially now, people are wanting to find a healthcare provider that looks like them, right? But we know when it comes to physicians, you know, across the country, I think about 6% of physicians are actually African American or Black. Here in California, I think it's about 3 or 4%. So, what suggestions do you have given those statistics? Would you have to someone who really wants to find a healthcare team or create a healthcare team that reflects their identity, values, and cultural background?
Yeah. So for most specialties, they have specialty societies that are Black, right? So, for example, the Association of Black Physical Therapists or the Association of Black Gastroenterologists who are, you know, uh, stomach and intestines doctors, the Association of Black Pulmonologists, lung doctors, the Association of Black Nurses. So you can go to any of these online, search them out online, and ask specifically, you know, in my area, who would you recommend, who's in, you know, who you know of that I could go to? That's one way of doing it. You can also ask your insurance companies. They sometimes keep statistics on those on very by specialty in terms of race, ethnicity, and language spoken of the providers in their network. So that's another way to do it. Word of mouth, we talked about that before. Don't never forget that. That's a big one. So I would say those are the three sort of best ways if you are dedicated to having a Black healthcare provider. If you can't, couple of other things. And it would be probably hard for you to know this except maybe by word of mouth, but if a provider has a pretty mixed group of people that he sees in terms of race and ethnicity and language, they tend to be more culturally competent and more attuned to various people's needs, right? Um, it doesn't hold hard and fast, but if you're, looking for a substitute, that's one way to do it. The other thing is, again, I'm a big advocate of federally qualified health centers. Their whole, or which is another way of saying a free clinic, right? Their whole philosophy and reason for being is to serve underserved communities. And they really see people from what's called a patient-centered medical home perspective. They really focus on the needs of the patient and making the needs of the patient paramount, and often train their staff to be culturally competent and attuned to the needs of the communities that they serve. So, always have that in your back pocket as a possibility as well.
Great. And I see there, I think there was a question that popped up in the chat. Charity, is there?
Yes, there is. Mhm.
Can you read it, please? Thank you.
We just, I think she just answered the one about the referrals. So do you have what recommendations do you have for people in rural areas that are dealing with not having enough providers or enough providers that accept Medi-Cal or cover California?
Excellent question. So, again, if you have Medi-Cal, you can go to, and you're probably going to be in a managed care organization that provides care, coverage for Medi-Cal patients. So you can always ask that your coverage provider for your Medicaid what providers see people using telehealth and telemedicine and get virtual visits as a way to sort of bridge the gap. It's obviously not going to work for every kind of visit. There's some visits that lend themselves better to telehealth. For example, dermatology or mental health providers. So use that when you can. I think right now that's the best answer to increasing access to care in rural areas. Um, Again, there are providers in rural areas. They might be few and far between, and so therefore they have um, large numbers of people that they're seeing. So the best thing is, again, to be proactive, especially with your preventive visits. You might know that it's going to take you 3 to 6 months to be seen. So go ahead and schedule that preventive visit now, so that you can make sure that you get in to be seen. And then there are also a lot of urgent care type nurse provider lines that can help you decide, do I need to go to an emergency department? Can I wait and make an appointment with the doctor? Again, that your insurance provider might provide for you to, again, help you make decisions about when and where you should be accessing care.
Yeah, and sometimes if, like to your point, sometimes it's really hard to get in to see a doctor, but you can schedule an appointment to see a nurse practitioner,
Yeah.
which in most cases might be a little bit easier, relatively speaking, but you can get the same type of service. They don't have an MD behind their name, but it's I think, a good mixed alternative to having to wait to see a physician if they're telling you have to wait 3 months or more.
I would say the one piece of good news is that and this is probably going to take a couple years to manifest, but there has been $50 billion allocated to improve rural healthcare and make rural healthcare more accessible. So those funds are just now being tapped into to create more options like mobile clinics, greater broadband access in rural areas so that your telehealth visits can be more seamless. So there are going to be a bunch of different solutions that we'll see in the next few years as a result of those funds being allocated.
Thank you. And I do want to also mention that here at CBHN, we are working on creating a Black provider health and wellness directory. We are in the process of populating it with Black and culturally competent health and wellness providers. We really want to take more of a holistic approach to the providers and practitioners that are in the directory. So right now we have a significant number of doulas and midwives and community health workers. We have primary care physicians. We have acupuncturists, I believe. So we are continually working to make sure that we cross all the bases so that it can be a one-stop shop and resource for folks. So we can put the link in the chat for those who may be looking for someone here in California in their area that looks like our community. So just wanted to raise that.
And I'd also like to add in, there's also an organization called the Black Mental Health Alliance. They're actually based in Baltimore, but they have a nationwide provider network for mental health alliance, mental health providers that are Black. And, some of them can see you virtually, even if they may not necessarily be located near where you are. So also, if you're specifically looking for a mental health provider who is Black, that's an option as well. But
Thank you.
kudos to California Black Health Network for doing that. It is sorely needed. So thank you so much.
Thank you. Yeah, we're still trying to populate it with providers. So if you know you have friends and colleagues here in California, please do encourage them to opt in to sign up and complete their profile. So
I do. I went to University of California, San Francisco for med school. So many of my colleagues stayed in California. So I definitely do. I'll let you know.
Okay, yeah, we'll share the link with you. Thank you, Charity, for putting it in the chat, but I'll make sure that you get it directly.
Great.
So we have another question. What recommendation would you have to communicate with an elderly patient, or I guess that's supposed to be patient, that has had the same doctor for over 50 years and that their provider hasn't really been keeping up to date on medical technologies? There's a loyalty there due to, I guess, the longevity of the relationship and the provider being the same ethnicity, but the level of care is not optimal. So what would you suggest in that case?
That's a tough one. I'll be quite honest with you because trust is so important in the doctor-patient relationship. And I would probably pitch it to the older person as, look, I wouldn't break that bond that they have with that provider, but I would also encourage them to, hey, let's look for somebody who can do XYZ for you in addition to what you're getting from your current provider. And then hopefully they'll be able to build a new relationship with that provider. And I would actually, if you're the medical power of attorney for that older person, I would let that provider know, the new person know, and explain the entire situation. So they'll bend over backwards, right, to try to woo that individual, number one. And number two, when needed, it would be important to be able to access the records from the other provider so that tests aren't being duplicated. Because you want to avoid that. I mean, it's uncomfortable and time consuming for the individual. So you want to make sure that that new provider also has all the information and access to records that the previous provider has.
Great, thank you. Just before I move on, Charity, are there any other questions by chance in the chat?
Nope, none that I see for now.
Okay, great, thank you. You know, I think that with HR1 happening, and, you know, we know here in California that there's about 600,000 or so people that may lose their coverage if they're on a covered California plan, our version of the ACA, and many, many more who are on Medi-Cal. And so I believe that it's going to be incumbent upon us to not only just be proactive about our health and well-being, but to focus more on prevention, so that we don't see the exacerbation of health outcomes or health disparities. And so I'm only bringing that up because when we talk about or think about preventative screenings, I know some folks in our community avoid doing that because of past experiences or, you know, fear, lack of understanding, or that mistrust. But what message would you share with folks now, to make them shift their mindset about doing annual screenings? I know sometimes I've heard people say, well, I don't want to know if, you know, I go get a mammogram or whatever. I don't want to know, but that's the worst thing that you can do. But what message would you have, or what would you say to people to try to shift that mindset, especially now?
Yeah. Look, you know, with let me first start off by saying when I think about preventive visits and screenings, I also roll in there vaccinations, right? Because it's a package deal. Vaccinations and preventive screening have played a role in increasing our average lifespan over time, from 35 in the late 1800s to 60 to 80, for some groups in the 80s, 80s to 90s, right? And so it works. Those people who say, well, I'm just going to eat organically and exercise, they were doing that in the 1800s, right? And the lifespan, average lifespan, was much less than it is now. The same for infant mortality. Infant mortality was way higher, much higher, as well as maternal mortality was way higher before we um, had preventive screenings and vaccinations. So those are some of the things I would say. And then secondly, as Rhonda, you just said, it's important to get ahead of certain things and find them out as early as possible, whether it's a chronic condition like high blood pressure or diabetes, which if untreated goes on to lead to heart attacks, strokes, and kidney disease that can progress to dialysis, and amputations. Um, as well as cancers, which, if caught early, many of them are treatable, especially breast cancer, which has a very high survival rate if you catch it early. And there are multiple other cancers like that as well. So it's better to know, be proactive, know that you still have agency because of the 5 self-health actions that we talked about before. They're going to um, have a great impact on how you deal with the chronic disease in conjunction with more with medical treatments that can slow the progression of chronic disease, can cure cancers, etc. So I think sometimes people are afraid of finding out because they feel that they won't have any control. I think it's the opposite. When you're armed with the information, you then have more control to be able to be very targeted and focused on addressing your health.
Yeah, so can you remind everyone what the 5 self-help messages are before?
Yeah. So nutrition, what we talked about before, hydration, keeping, 8 ounce glasses of water a day if you're healthy, and then adjusting that if you have a chronic disease like kidney disease or heart disease, you can adjust that with your doctor. So nutrition, hydration, sleep, movement, and managing the stress in your life.
Great. Thank you very much. And I want to say, I am a living example of what you said about early detection. I celebrated my 17th year this year as a breast cancer survivor. So I was a stage one, and acted quickly, to go get everything checked out and went through treatment and all of that. So 17 years later, so far, so good. Um,
Amen. That's beautiful. And
thank
I
you.
want to add on to that. In my video podcast that's on Monday nights, 5 p.m. California time, um, in October, which was Breast Cancer Awareness Month, we interviewed Shanice, who's a singer. You know, I Love Your Smile,
Oh,
right?
yeah, 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 yeah.
Yeah, she is a breast cancer survivor just this past year, right?
Okay.
She talked about, was very transparent and open about her treatment, how it affected her career, the choices that she made, how she advocated for herself. But the key was that she caught it early. And as such, you know, like you, she has fantastic opportunity for longevity, having caught it earlier rather than later. You can go to Dr. Melissa Clarke YouTube channel and see that episode. It's really, really moving.
I'll have to check that out. Thanks for letting us know. So we do have another question in the chat, and it is, how can we convince Black dads about their babies getting vaccines? Right? It could be Black dads and moms, but
Sure.
especially if they're vaccine averse.
Yeah. Well, one of the things, you know, that was really cleared during COVID and talking to people about vaccinations, first of all, the whole concept of vaccines came from Africa. It was brought over by an enslaved individual named Onesimus in the 1700s that was doing a form of vaccination um, that then later evolved to what we now know as vaccination. And he prevented hundreds of people dying in Boston, which is where he was enslaved, because he shared his what had happened to him in Africa in terms of getting vaccinated against smallpox with the person who enslaved him, and that person, Cotton Mather, went on to spread it and saved again hundreds of people in Boston from smallpox and dying of smallpox. So that's the first thing. Secondly, again, as I mentioned before, with infant mortality, before babies dying, before we started doing childhood vaccines. Um, and we have seen a remarkable improvement in survival of babies and toddlers, infants, having gotten vaccines against those childhood vaccinations. Thirdly, the concern specifically about autism is unfounded. It was flawed science. Somebody who basically published something that was inaccurate, that you know people then picked up and spread, but it has been debunked, and there is not an association between childhood vaccination and autism. So that's something that should be taken off the table entirely. And just one last thing, everybody is probably familiar with shingles. There's been an association, and this is still being studied, between the virus that causes shingles and cognitive decline, such as we see in dementia. Um, we now have a vaccine in childhood, the chickenpox vaccine, that is, if a child gets it, they won't get chickenpox, which is what ultimately leads to shingles as an adult. That's an example of a vaccine that can that has basically wiped out getting getting this virus that can cause all these other problems later in life. And so the benefits, when you weigh the risks versus the benefits way outweigh the risks of getting vaccinated as a child.
Great. So thank you so much for that information and that little known Black history facts. We did not know that. So thank you for
Yeah.
sharing that information. So I can't believe it's
Google
like,
Onesimus and you can
yes.
read up for
Okay.
yourself.
And then also I think it's important for us, to your point, don't believe what we always hear, but do our own due diligence and research to get evidence-based factual information, especially when it comes to our healthcare. Because
And
we have a,
let me
no,
say
go ahead.
too, research doesn't mean going on Instagram and TikTok.
Right. Yes, thank you
Research
for the
means
question.
going to the journals that are published by the experts and reading them and understanding them. If you don't, talk to your doctor who can help translate them for you, or somebody, a nurse or a family member who can read those and help translate them. Research is not Instagram and TikTok because that has a lot of misinformation.
Great. And can you say the name of your podcast again that you mentioned a few minutes ago?
Sure, it's called Excuse Me, Doctor, and it's every Monday evening, 5 p.m. Pacific, 8 p.m. Eastern Time. Um, it goes for an hour. We cover a variety of topics, different topic every week. And the archives of them are on YouTube at Dr. Melissa Clarke, Dr. Melissa Clarke, for those who want to look it up.
Okay. And also they can access it through your website?
Yes, you can access it through the website, yeah, which is also drmelissaclarke.com, drmelissaclarke.com.
Okay, great. I can't believe that an hour has gone by so fast already. But I do want to try to wrap up, and I think this is an important thing to address if we can do it quickly. But the last session we had in October was about financing your healthcare, and I think that is probably going to become a bigger concern for folks. Again, with the impact of HR1 looming around us. So can you just like quickly do a high level? I know last time you broke down about insurance, but what do you think people should do about paying attention and getting, uh, you know, coverage and managing cost and being able to cover the cost of healthcare, especially if they're going to lose or stand to lose their insurance?
Yeah, well, I would mention that there are organizations that help with copays and deductibles. So if you're somebody that, doesn't qualify for Medicaid and has to, get purchase plans from Covered California, um, consider the various organizations that can help with getting help for copays and deductibles. And I listed them in that module in that session about financing your health care. Um, in addition, there are other organizations that will help pay for medications, right? Again, those are listed in that same session, which I know you made the PowerPoint available to other folks, but some of them include the Patient Advocate Foundation Copay Relief Fund, the Chronic Disease Fund, the Partnership for Prescription Assistance. So again, there are ways to help get financing to help pay for some of the costs that might be prohibitive or really high for people to pay. And then, as I mentioned before, if you do qualify for Medicaid, really make sure that you stay on top of the eligibility requirements and the fact that you have to renew. That's not coming this year. It's probably coming in 2027. But that's going to be important. You might have to renew your eligibility every 6 months, right? So keep on top of that. And also, again, the work requirements piece that we talked about before, volunteering, being in school, and work all qualify for that. And then finally, again, if you don't qualify for any of those and you're uninsured, always know that you can get care at a local community health center or a federally qualified health center, also known as a quote unquote free clinic. They see you based upon income, So on a sliding scale, meaning if you make very little money, they might see you for free, versus if you make more money, they'll adjust the rates according to what you can pay.
Okay, great. Well, thank you so much, Dr. Clarke. Hopefully this was informative, and hopefully everyone who did have a question got their question answered today. So just wanted to wrap up and say thank you all for coming today. Also remind you of a few events that we have coming up between now and the end of the year. So on December 2nd, this is a members only, actually, if you're a paid member of the Black Health Network, you get to come to the session. It is a end of year check-in and perspective looking forward into 2026 with me talking about what is happening with CBHN, where we are, where we're headed. December 2nd is Giving Tuesday. So if you are looking for a nonprofit to support and give to that day, please think of CBHN. Also, looking into next year on February 25th, we are hosting our first ever virtual conference. It's a mental health and behavioral health conference that will be on Zoom from 8 to about 1 o'clock that day. So please note that on your calendar and save the date. We'll be sending out an official save the date notice soon, but just wanted to put all those things on your radar. And if you take our survey, I guess we are going to offer an opportunity for all of you who want to or will take our HR1 survey. You will enter a chance to win a $100 gift card, a $100 Visa gift card. So if you can scan the QR code here to take the survey, we really want to hear from you about your thoughts on HR1, what you know about it, what you don't understand about it, what you really want to know about it, and your feelings about how it will impact your access to healthcare and impact your health and well-being and longevity. So please take a moment to scan the QR code and fill in the survey. I think Charity also may have put it in the chat. So again, you enter for a chance to win a $100 gift card. So the person who asked the question at the top of the hour, hopefully they're still here. So you do have another opportunity to win a $100 gift card. And then just finally, if you're not connected to us or following us on social media, it's pretty easy. It's your CBHN on Facebook. We're not so much on X anymore, but also on Instagram and on LinkedIn, as well as YouTube. It's the California Black Health Network. So please connect with us, follow us, join us in the campaign for Black Health Equity. We'll be making a new announcement coming up in the next couple of weeks about a new bold campaign that we're embarking on. So stay tuned for that as well. And happy Thanksgiving, safe travels if you're traveling out of town to visit friends and family. And we look forward to seeing you at our next event. So thank you and have a great afternoon.